It continues to increase in Denver County, around the metro area and in our state, and indeed in the surrounding states as well. And so we are not an exception to any of those trends. So the case rate, the hospitalizations, and the percent of tests that are positive, those are all key metrics, are all increasing. There appears to be very little transmission within the schools. And I think that's not just a finding from the Denver metro area, it's being replicated around the country. So we think it still is possible for schools to be safe places at a time when COVID is very active in our community. So there are large and persistent differences in the risks of COVID among all age groups in different neighborhoods in Denver, and DPS is committed to treating its schools equally. And that's a challenge when you have very different rates of COVID around the city. You know, we developed this dashboard back in July, was it? Or August. We chose metrics and thresholds at that time based on what other big city school districts were suggesting, what some sets of national guidelines had. I think what we've learned since then is that there is less risk of transmission within schools than had been expected when the basics are followed. And so Dr. Federico and I are rethinking, along with others, now with that additional knowledge, what should a dashboard of metrics look like? We're not trying to move the goalposts. We're trying to update guidelines based on developing knowledge. To extend schooling at a time when case rates are not just high, but increasing is difficult. So I think stabilization in key metrics like case rate, like hospitalization would be great. But we are actively re-examining that question based on the data locally and nationally.